Hi, my name is Maas. I'm a registered osteopath and I'm also a doctor of integrated medicine, and I practice functional medicine here in the UK. I've been doing it for about 26 years now. My first practice was in Barbados for about 22 years, where I got to see a lot of patients who had chronic diseases, chronic gut problems, chronic spinal problems, and met a few professional surfers that I helped treat and reboot their careers. But at the end of it, what it really comes down to is that I'm now in England and I've set up this functional medicine practice, and this video is to basically enlighten you, the audience, into what functional medicine is, what is integrated medicine, and how it can benefit you. So since I arrived in the UK back about 5 years ago, it's been, really interesting to see how people have sort of approached me. They've been mainly sort of researching on the internet, looking for websites like Institute of Functional Medicine, Dr. Dan Kalish, etc. And they're looking for answers that the NHS can't actually give them. The key issue is that, as I believe, as an integrated medical doctor, is the kind of NH system is a broken system because it basically goes for symptoms and it only prescribes drugs, and there's no real true remediation to actually what's causing the problem. So with integrated medicine, it's basically summarizes, sort of nutrition, exercise, behavior, and lifestyle. And if you can change those for the better, you've got this kind of already this integrated approach. But with functional medicine, it's kind of a little bit more in-depth and scientific, and the principles of integrated medicine are absorbed into functional medicine, but the key issue is that functional medicine goes into the deep dive of the biochemistry, the urine, the stools, the microbiome, the DNA, the genetics, and starts to build a plan to get out of that problem situation. So it's been very successful, and I'm very, very pleased and proud to present this video to you, introducing functional medicine. And I will be designing a series of informational videos, short, sharp, to the point, and it's going to give you, the audience, the tips that you want to know to make your life a lot better and healthier. And I mean, if you do some background research on me, you can see some of the patients that I've treated. And if you really want to be a superstar, or if you just want to be a super housewife, functional medicine can fix it. The key issue is you've got to be able to have the discipline and the determination and be able to be open-minded to a new medical model, which really integrates everything into one sort of program. And once this has been designed based on the blood chemistries and all the evidence, then the person can actually apply this. And what happens is that the person slowly develops a routine 24/7. They're literally going through this ritual of eating the right foods, taking the right supplements based on blood chemistry, of course, and they're basically changing their lifestyle and their behavior. They're fixing their adrenals, fixing their gut issues. And then what happens is there's this chrysalis of transformation in about 3 or 4 months, and people just change wonderfully. And you can prove it with the blood chemistries, and this is what we do. We do objective data, we retest and retest until we've pushed that patient's physiology back within the optimal ranges. Not the standard ranges that the lab tests use in the hospitals. We in functional medicine use a very, very narrow range, which is the optimal range on the bell-shaped curve of a mathematical model. So our testing is more sensitive, it's more diagnostic, it's more accurate, it elucidates causes, and it designs a treatment plan to get better. And it may take 3, 6, 9 months, but the evidence will show the trending towards optimal recovery. So stay tuned for more free information using functional medicine in your daily life so that you can get the health that you really want.